Welcome back. In this video, we'll revise the electrical system of the heart. So think with me. This is the SA node, which is the primary pacemaker of the heart. It fires or discharges the electricity at rate of 60 to 100 per minute. So our basic heart rate is 60 to 100. If it is below 60, it will be a bradycardia, and if it is above 100, it will be a tachycardia. As we said, it is located in the roof of the right atrium near opening of the superior vena cava, and this SA node, this generator, is controlled by two nerve systems, which is the sympathetic, which causes the SA node to increase its firing above 100, as in situations of fear or anything that causes sympathetic to fire, and controlled also by a parasympathetic nerve fibers, which cause the SA node to slow down, as in the emotional situations your heart rate will be slower. The all parts of the electrical system are supplied by two coronary arteries. In the next lecture, we'll discuss coronary circulation in depth, but generally speaking, you should know that all electrical system is supplied by two main vessels, the right coronary artery and the left circumflex artery. Then the SA node distributes its electricity to both atria through it sends its electricity to the left atrium through the Bachmann bundle. Then it distributes its electricity to the right atrium through three internodal fibers or bundles, which is the anterior internodal and middle internodal and posterior internodal tracts. Then this electricity come and fuse to form the stabilizer of the heart, which is the AV node. If you see from this demonstration, this is the aortic valve and the aorta, and the AV node is near the aorta. So as we said in TAVI, you can injure this node. So this is the AV node. Formed by merge of the inner nodal pathways. It is a non-branching portion of the next bundle, which is the bundle of Hess. So, as we said, the AV node will be supplied by two vessels, right coronary artery and left circumflex artery, and it is the stabilizer of the heart, as it makes the electricity stable or produces a physiological delay about 200 milliseconds in order to make atria and contract and ventricles not contracting simultaneously. Then the bundle of Hess, this part, which is located in the upper portion of the inner ventricular septum, its rate of firing 40 to 60 per minute, and what it acts and becomes the primary pacemaker. If we lose the function of the SA node, then this rhythm is called a nodal rhythm, and the patient heart rate will be from 40 to 60 per minute. Okay, this part, which is his bundle, is also supplied from the LAD, left anterior descending artery, as we will discuss later. In addition to the right coronary and the LCX, so it is less vulnerable to ischemia. I mean, if the patient develop acute myocardial infarction, this part, which is his bundle, will not be affected more. And then from his bundle, it gives a right bundle branch to the right ventricle, and this part called the moderator bundle, which is a muscular bundle in the right ventricle, makes the right bundle to give branch to reach the other wall of the right ventricle. Then it gives to the left ventricle, the left bundle, which divides into the left anterior fascicle to the anterior portion of the left ventricle, and the left posterior fascicle to the posterior portion of the left ventricle. And finally, the Purkinje fibers, which supply or gives the electricity to each cardiomyocyte, and it has an intrinsic rate of 20 to 40 per minute. And this rate occurs when all electrical system of the heart become dysfunctional or functional, not working at all. Then Purkinje fibers can discharge an intrinsic rate of 20 to 40 per minute. And this form, we call it escape rhythm. Know this word by heart, because in the later sessions of the dysrhythmias, we will repeat again what is called escape rhythm and nodal rhythm, etc. So if you think here, the impulse electrical impulse spread from endocardium to the epicardium. Okay. We have mastered and understood all what we need to know about the electrical system of the heart. In the next lecture, we will discuss in depth the all what we need to know about the coronary circulation and coronary arteries. Stay tuned and see you. Welcome back. After we have known what is an ECG and its diagnostic value, and we have discussed in depth all what we know about the electrical system and the electrical activity of the heart, also we should know in this basic level the coronary circulation. Why? Because one of the main values of ECG is to diagnose ischemic heart disease. So, what is the meaning of an ischemic heart disease? It means stenosis or complete obstruction of one of the coronary arteries, which supply the blood to the heart or to the myocardium of the heart. So, from ECG, after we will know in depth or know by heart the coronary circulation, we can know and discover which artery of the coronary circulation is the occluded artery, and define the type exactly of the coronary obstruction and of the myocardial infarction. So from ECG, I can diagnose an anterior infarction or anterior STEMI, and from this, I can expect that the left anterior descending artery is the occluded artery. How can we do this? That's what will we know sooner. انا هوقف بس على ما الاذان يخلص يا عزام عشان ما يطلعش في الفيديو. Let's go to the whiteboard and see the coronary circulation. If you look, this is the aortic valve, and this is the proximal ascending aorta. If you remember from the anatomy, they always told us that there is only one branch, or there is only artery come from the ascending aorta, and this was the coronary circulation or the coronary arteries. As we know, this is our heart, the left side, left ventricle and left atrium, and right side, right ventricle and right atrium. The coronary arteries, I have two main sets of coronary circulation. This is called a left coronary sinus, and this one is called the right coronary sinus. From the right coronary sinus, the right coronary artery arises. So this is the right coronary artery. And from the left coronary sinus, the left coronary artery arises. Let's start with the right coronary artery. Yes. So let's start with the right coronary artery. This artery arises from the right coronary sinus. At its proximal part, it gives three small vessels. One is called conus, and this part or the conus vessel go to the root of the pulmonary artery. So this part supplies root of pulmonary artery. And this branch, and as we will know later, that this part, which is called the conus, which is the root of the pulmonary artery, is a very irritant part, and it produces different forms of VT, which are ventricular tachycardias. So if there is an obstruction of the conus artery, patient can develop different forms of VT, ventricular tachycardias. Then it gives a branch called SA nodal branch, blood supply to the SA node, as we said, that SA node and AV node take its main blood supply from the right coronary artery, and one branch to the AV node. Then from its middle, it gives a branch called RV branch, which gives the blood supply to the right ventricle, which supplies the blood to the right ventricle. Then the right coronary artery, abbreviated into RCA. RCA. So these are international abbreviations. You should know it by heart. So RCA, which is the right coronary artery, run on the inferior surface of the heart, supplying the inferior wall of the heart, then gives it two branches. Some branches called BL branches, which are the posterolateral branches, supplying the posterior wall of the heart, and give a PDA, posterior descending artery, which supplies the posterior surface of the heart. This is the right coronary artery. To revise, it arises from the right coronary sinus. From its proximal part, it gives small three branches: a conus branch to the conus, SA nodal branch to SA node, AV nodal branch to AV node. From its middle part, it gives an RV branch, right ventricular branch to the right ventricle. Then it works on the inferior surface of the heart, supplying the inferior surface or the inferior wall. Then it divides into a posterolateral branches to the posterior surface and posterior descending artery to the posterior surface of the heart. So right coronary supplies the inferior and posterior surfaces or parts of the heart, as we will revise later. Okay, then from the left coronary sinus, the left coronary artery, which we call it left main or abbreviated into the LM, left coronary artery. And as we said, the left side is a large, representing 2/3 of the heart. So it will be divided into two main branches. And left anterior descending branch, which we call it LAD, left anterior descending, which descend on the septum and the anterior surface of the heart till reaching at the apex the posterior descending artery and anastomose with each other. This branch is called an LAD, left anterior descending artery, and this is a very large branch supplying nearly 60% of the ventricle. And this left anterior descending artery gives two sets of branches. To the inside, it gives septal branches to supply the septum. And on the other side, it gives a diagonal branches run on the lateral surface of the heart called diagonal branches, D branches or diagonal branches. Okay. Then the other branch of the left main is called the left circumflex, and it is circumflex because it goes around the lateral surface of the heart. So we call it left circumflex, or abbreviatedly an LCX branch, left circumflex. It go and wrap around the lateral surface of the heart, then go posteriorly, and it gives a branches called marginal branches, and in some situations it can give a BDA, posterior descending artery. How this? You told me that the BDA arise from the RCA, right, coronary artery. Then you tell me that there is another BDA. Yes. If the according to BDA, we divide the coronary circulation into right dominant circulation, in which the BDA arise only from the right coronary artery, and there is no BDA from the left circumflex. Or it may be left dominant circulation, in which the BDA arise from the left circumflex and there is no BDA from the right coronary artery. Or it may be a co-dominant circulation in which there is a two BDA, one from the right coronary artery and the other one from the left circumflex. So this is the coronary circulation with its branches. We should know which part or which wall of the heart supplied by which branch in order to know from ECG the type of myocardial infarction, the type of MI, and which artery is occluded. When we go and do a coronary angiography and see the coronary circulation, we are expected which vessel is occluded from an ECG. So we will know the different parts of the cardiac walls and which artery supply it. Let's see. If you look, if we take a cut section in the heart, it will be like this. It will be like this, like a circle. From this circle, we can know the different walls of the heart. This is anterior and this is posterior. So this part is the anterior wall of the heart. Opposite to it is the posterior wall of the heart. And in between, besides the anterior, this is the lateral wall. And besides the anterior from the opposite side is the septum. And between the posterior and the septum, there is the inferior wall. So this part is the anterior, this part is the lateral, this part is the posterior, this part is the inferior, and this part is the septal wall. So abbreviatedly, we called it salbi. Salbi means in Arabic negative. So salbi is septal, anterior, lateral, posterior, and inferior. So which coronary artery supply each these five parts of the myocardium? The septum is supplied by the LED, which runs above it and give to it septal branches. The anterior is supplied by LED, which run above it. The lateral is supplied by the left circumflex, which goes through and wrap around the lateral surface of the heart. The posterior is supplied by the PDA from any vessel it arises from, and the BL branches, posterolateral branches from the right coronary artery. And the inferior is supplied by the right coronary artery, which wrap around the and run on the inferior surface of the heart. So we at this part we have known that there is a five walls of the heart. Abbreviatedly we call it salbi, septal, anterior, lateral, posterior, and inferior, and each part of this is supplied by certain coronary artery. This image is very important because, as we know later, that every image of the ECG supplies imaging and representing a certain part of the walls. So if there is ischemia in this part, I know that this wall is ischemic, so this artery is the occluded artery, or what we call it a culprit vessel. I mean the vessel responsible for culprit means the vessel responsible for the MI, or the occluded vessel causing the MI. Okay, so in this video we have discussed the coronary circulation. In the next video we will discuss how ECG works and the idea of imaging the electrical activity of the heart. Stay tuned and see you.